St. Lucia's healthcare system saw a tangible boost on Tuesday with the official inauguration of a 12-bed ward at the Victoria Hospital, marking its transition to a revamped secondary care facility. The repurposed former respiratory hospital will complement the OKEU hospital at the Millennium Heights Medical Complex, bolstering the island's medical landscape. This development signals a commitment by officials to optimize the healthcare infrastructure and expand access to crucial medical services for St. Lucians.
It's a pleasure to welcome you to this official commissioning of the 12-bed ward of the new secondary care facility. It's not the commissioning of the entire facility today. We are truly appreciative of your efforts for gracing us with your presence here today. This is another milestone and cause for celebration for the Board of Directors, for the Ministry of Health, Wellness and Elderly Affairs, and the Government of St. Lucia. I reference another milestone because just 4 days ago, several of us here met to celebrate the commissioning of the oxygen generating plant, which is now in full operation at the Owen King European Hospital. Please note that in the coming months, there will be more events for celebration as we roll out other initiatives, both big and small.
During the pandemic, the Victoria Hospital served as the island's primary COVID-19 treatment center. Now, the storied building will not only be home to the secondary care hospital, but what is being called the Castries Multipurpose Healthcare Facility.
August 2022, following the gross reduction in the number of COVID-19 patients requiring treatment at the respiratory hospital, the Ministry of Health, Wellness and Elderly Affairs sought to examine and strategize towards the repurposing of the valuable infrastructure that we see on these premises here at the former Victoria Hospital. In consideration of this, the Cabinet of Ministers directed the repurposing of the former Victoria Hospital into the Castries Multipurpose Healthcare Facility. This facility is proposed as a 3-tier functional healthcare facility which will provide services within 3 significant components of the healthcare sector, namely the primary healthcare services through the establishment of the Castries Urban Polyclinic, the urgent healthcare services which are to be operationalized through the Castries Urban Polyclinic and run by the Ministry of Health, Wellness and Elderly Affairs, and the secondary care healthcare services in the form of the secondary care hospital operated by the Millennium Heights Medical Complex.
Officials emphasizing the commitment to serving the broader community is plotting the trajectory of the second phase of the revamp.
So what would our phase 2 works look like towards bringing this facility to completion? In phase 2 of this project development, the full version of the hospital will become more complete and apparent. Works will include complete remediation of the remaining 19 inpatient beds. These will be self-contained rooms with significant upgrades to bathrooms and furnishings, air conditioning, hot and cold water systems, and a patient nurse call feature, to name a few. Private rooms will be available for patients requiring privacy. We'll upgrade and modernize our kitchen operations. We'll undertake minor infrastructural works to our intensive care units. We'll modernize our 2 operating theaters with laminar flow and state-of-the-art medical equipment.
Public health officials call the project a significant step towards ensuring accessible quality health care for all. But Health Minister Moses Jabatis, who points to the incremental progress made over the years, is leery of paralysis by overanalysis.
For me, if we have this goal of achieving universal health coverage, whether you are in the primary health sector, the health centers, whether you are working at the hospitals or managing the hospitals, or whether you are facilitating tertiary care, if we cannot connect the dots, we have to try to sit down to connect the dots and ensure that these connections lead to better health services, better quality, and reduce financial hardship on our people or those accessing the health care. We can continue to debate about how it's done, But if we debate for decades and decades and decades and we do nothing, then debating is just an academic exercise. I love academia, but I also love action.
The Millennium Heights Medical Complex will have oversight of the secondary hospital, with the other institutions like the Urban Polyclinic operated managerially through the Ministry of Health. Joachim Duplessis, HDS News Force.